Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. I have a few guests in the studio, and so I'm going to let them introduce themselves in a few moments. It's going to be a great podcast today because we're going to talk about peptides and lots of information about peptides. But so as you know, like I'm ER physician, worked for 25 years in ER, traditionally trained, and started to venture into the anti-aging regenerative medicine world over a decade ago because I started to notice changes and I realized that there weren't any answers in traditional medicine, but there were a lot of answers once I started to learn more about anti-aging medicine. So now my goal is to bring comprehensively all those solutions to you to look, feel, and function better. So today we're going to talk about peptides, and I have some guests. So I'm going to start with Marissa. If you just want to say a few words and introduce yourself.
Hello, I'm Marissa Staten. I'm Dr. Durst's medical esthetician. I've been a medical esthetician laser technician for about 13 years, and I'm glad to be here.
She's awesome. She is the best. Just going to add that in since she didn't say it. And then if you want to introduce yourself, Faraday.
All right. My name is Faraday Golembieski. I'm a family nurse practitioner.
Wait, say that last name a little bit slower again.
Golembieski.
Yeah, I know. It's not a hard one. I love it. I'm getting it down. Starting to
None
get
of
it down.
it's easy.
I know.
Right? First or last. It just isn't. I just go by Faraday.
Yeah.
It's easy for everybody. Again, I'm a family nurse practitioner. I started out as an RN at the hospital working in the neonatal intensive care unit, and then went back to school and quickly learned that traditional medicine does not answer the questions I want it to answer for my patients, and that there is more out there. So through my own exploration, through education and going to seminars and joining these anti-aging groups, I started seeking out more, looking at bioidentical hormone replacement, looking at peptides, looking at how we can change how we function from a natural point of view, how we can be better, right? Improve the overall health. So that's how I ended up here with Dr. Durst and working at Revitalize, because we have the same common goal that we want for our patients.
That's right. She's like my clinical soul sister. Like she thinks the same way I do. And so again, like just adding it comprehensively and being proactive. And as somebody, a lot of times patients will bring things to us and then we'll go learn about it because it actually complements what we do. So I love it. She is as driven as I am in providing all those solutions to our patients. So, and then Lori is a patient of ours, and I'm going to let her introduce herself.
Hi, I'm Lori Naples. I live in Ohio. I'm a remote patient of Dr. Durst and Revitalize. I've been with her since you opened, basically, and so quite a few years now, and have done various treatments, procedures, different therapies, supplements, pretty much everything. Everything you have to offer, I've tried different aspects of. So love it. Completely different than traditional medicine in treating comprehensively the entire body, how it functions, and getting it more optimal is, what everybody wants. So, so I'm very happy to be here today to join you girls.
Yes.
So, thanks for having me.
And she has seen it branch over this period of, years because, and just branch out into other areas. And so, starting a lot sometimes with aesthetics initially, and then hormones, and even the hormone and hormone optimization has changed over years. You just fine tune your ability to optimize and control side effects and, educate patients. So one of the things that we have progressed to is use of peptides. And so we're going to talk a little bit about peptides today, maybe some frequently asked questions on peptides as well. And we're almost going to let Lori, not almost, we're going to let Lori lead the conversation because, again, she's a patient and she is on peptides, but also she knows what patients want to hear and the questions that they're going to be asking. So we're going to open it up to everyone. We're all familiar with them and let her lead the conversation today on some frequently asked questions on peptides.
Okay, so I think where we should begin is what are peptides? A lot of friends of mine ask me that, have now become patients of yours, what is a peptide? What does it do? Is it medication? just what is it? How do I administer it?
Yeah.
They have no idea.
So a lot of people haven't heard the term peptide before. And so again, the first peptide ever was insulin. And so again, we started way back kind of getting that we needed to give the body back what it needs. So insulin is identical to what we have in our body. And so then we can give it in the peptide form. So what peptides really are in simplicity is amino acid sequences. So amino acids are protein building blocks of proteins, and peptides are proteins. And so they're amino acids that are paired together to simulate a hormone or a neurotransmitter in the body and give the body back what it needs to repair or do different functions. So anything else you'd like to add about that?
When we're talking about peptides, we're talking about, like Dr. Durr said, those essential amino acids, and those start to decrease as we age. So these are naturally occurring things in our body that as we age, starting around our 30s, we start to decrease about 1% every single year. So you can have significant decreases in these amino acids and peptides naturally occurring in our body over your time frame of your lifespan. So all we're doing is replacing what the body is losing. And what we're replacing that with are peptides, or these building blocks, these amino acids that are all grouped together to work and specify certain areas where we're aiming for. So whether that is skin or GI health or muscle building or fat loss or any of the multiple things peptides are great for, we're focusing on those different things.
Mm-hmm.
Okay. What would you say are the top? Do you have a top 2, a top 3 of your favorite peptides that, or more commonly that you prescribe, or?
Yeah. Well, I think there's lots of that I can go on forever about, because I have lots of favorite peptides. But I will say that.
That's why I asked you.
I know. Lots of
I think everyone at this table has some favorites.
Yes.
We have favorites for sure. And so again, it's a matter of, sometimes what am I prescribing the most kind of goes along with what my favorites are to use as well. And it just depends on, again, what function we're trying to accomplish. But for me, one of my favorites is CJC 1295 and Ipamorelin. And again, Ipamorelin, you may hear it, Ipamorelin, it's pronounced different ways, but very simplicity. Ipamorelin is how we pronounce it. CJC 1295 and Ipamorelin combination is a growth hormone peptide. So both of those stimulate increasing growth hormone in the body in different ways. So CJC 1295 acts like growth hormone releasing hormone, which stimulates your brain to release more growth hormone, because we still have growth hormone spikes in the body. They're just, like Faraday said, they're mild, they're short, they're small. They're not
They don't
as
spike as high.
intense as they were. And growth hormone peaks at 20 and then goes down. Where Ipamorelin is paired with it, same injection, so you don't have to give 2 separate injections, but they're put in as a combination product, and that inhibits the negative feedback, and that's a growth hormone releasing peptide. And we can talk a little bit more of those different generations, but that is my favorite one. Again, it's a small volume. You're basically injecting it on an empty stomach, and you're simulating release of growth hormone in the body by those 2 particular products simulating a hormone or a neurotransmitter that is now not as prevalent in the body. So you get all the same effects of growth hormone except without growth hormone, which is, highly expensive, highly regulated, and can have some adverse effects with it. It can simulate like a low dose of growth hormone, but this way you're stimulating your own body's release and not shutting down your own system. So you get the same effects you get with growth hormone, and the same effects you get with testosterone, essentially, except bigger and better. Yep. And so now you can optimize testosterone and optimize growth hormone, and again, increase energy, brain fog,
Yes,
increase endurance,
exactly.
and decrease subcutaneous fat and body composition changes, and increase libido and sleep and all of those wonderful things. But now you can optimize both testosterone and growth hormone. And for me, I think that's where, I'll stop by just saying I can optimize my growth hormone and my hormones, and that's what makes me feel fabulous, because again, now you can optimize growth hormone, which we were missing before because we couldn't do it without giving it, and I don't want to give it. So that's one of my favorites. If anyone wants to comment on CJC 1295 or a growth hormone peptide, and then I'll go on to a couple different favorites of mine.
So I too love CJC 1295 and Ipamorelin paired together because of all the wonderful benefits that Dr. Durst was talking about. But a newer peptide I have started is Melanotan. So Melanotan is the tanning peptide, as everyone calls it. So it is great on a couple different things because it helps increase those melanocytes in the skin to help improve, tanning, get a beautiful glow. But it also can help increase libido, and it can also help some fat metabolism. So pairing that, because you can stack peptides, so that's not something we have talked about. So you can take CJC 1295 and Ipamorelin, and you can stack other peptides with that. So I'm taking the CJC and Ipamorelin, and I'm also taking the Melanotan on top of that, and BPC and Aod and all these wonderful peptides we'll talk about, because you can stack them. So it just helps even further by improving libido, fat metabolism, and then it also helps with the tanning peptide.
So when you say stack,
taking multiple peptides at one time.
the same time. I've had people ask me that. What do you mean when you say you can stack? So
Yeah, you can take multiple peptides.
just right at the same time.
Absolutely. Well, peptides are taken at different times depending on what peptide you're taking. Some you can take in the morning, some you take at night, some you take in the morning and night. It kind of just depends on what you are, which peptide you're taking and why you're taking it for. But absolutely.
I love the Melanotan. I mean,
Yeah, yeah.
100%. Yeah, that's one of my favorites.
Melanotan is an awesome peptide. Real quickly with the stacking, they're not drugs. They don't have side effects, and so you can stack without interactions between them. But you're going to do them separate shots. Just so stacking. You're not putting the products together. The only thing is you're stacking. And so CJC and Ipamorelin come together as a product, so that's one injection. And again, Faraday's right. Like, we're gonna dose it depending on what peptide you're getting. They're dosed differently in different times, but again, no matter what, even if you're stacking, it might be 2 or 3, or 4 injections you're taking, because the products are not put together, unless if it's like that growth hormone, peptide product, then that is put together. So that's the only thing in the Melanotan, the Barbie peptide, right? And I think all of us have used Melanotan, right? It actually ends up being a favorite of everyone. I have my tan. I don't like to be out in the sun, and because of all the aging effects of sun, and so, and it doesn't seem like it doesn't matter how much sunscreen I put on, I still end up, my freckles come out more. I can tell when I've been out in the sun. And so I do try to limit it completely. And then Melanotan helps me do that. I have a more uniform, beautiful tan with Melanotan than I do with the regular sun. And then again, it's the Barbie peptide, which could, increase your tan. You may have an increased sex drive and want more sex because it increases libido. And there's another peptide. They isolated that active ingredient that increases libido into a different peptide that we can use for sexual wellness.
And that's called
PT-141.
Okay.
And so basically, though, Melanotan can increase, so your tan, you may want more sex, and then again, it helps fat metabolism, so you may also have a decrease in weight or at least appetite. So, and you've tried it too, right?
Yes. I love the Melanotan. I'm not currently on it right now because I'm doing some IPL treatments, but I am going to start that again in about 2 weeks. Be prepared for summer in advance.
Well, your skin looks amazing.
It does.
With the IPL.
Thank you.
Yeah.
Thank you.
so smooth
It
and
lightens
fresh
and brightens.
beautiful. Yeah.
Thank you.
You are glowing, girl.
It's our favorite other treatment.
Yes.
One of our top 5s.
Yes.
And
I
if you're
plan on that this week.
Watching one of the videos again, the rest of it is like Faraday and I are tan, based on Melanotan, Lori as well. So it's a favorite for sure.
I will say one thing. I'm very fair, blue eyes, freckles, and all of my life I've burned. 20 minutes, half hour out in the sun, and I am red, and I never get browned. Never. I might, color, but it's just really not. Melanotan, no problem. Brown, I've never been a brown bear, ever. And I don't burn. I've had multiple basal cells and skin cancers and things like that I've had removed over the years, just growing up, in pool, going to the beach and all that kind of stuff, and bad burns. And you always say, I'm not recommending you to be in the sun. That's not a good thing. But I will say when I am, I do use my sunscreen every day, no matter what time of year it is, but when I am in the sun, I don't burn. So I believe you told me that there are some possible protective properties to the melanotan. And I guess that's, being that I've used it, I see that I don't burn now when I'm in the sun. And I'm not saying that that could be everybody, but I just know me and how, very easily I would burn.
And most people don't burn with it because it's bringing out the melanin, which is actually protective, and the sun is attracted to it. The only issue, so it is photoprotective in that you don't have to be out to get a tan, and you don't have to be out long, and you can get some. It's just never recommended that you're out for a long period of time with melanotan. In skin cancer history, again, that's the one thing, definitely melanoma, you would not want to use it in. And otherwise, just watching so that you're not out much. So it's photoprotective. And sunscreen, of course. Put on the sunscreen.
Always wear your sunscreen.
Have a drink and go underneath the umbrella instead. And all your
indeed.
friends will wonder why you're tan and no one else is, and you've been under the
Everybody
umbrella all
asks,
day.
well, where have you been? Where did you go?
Yeah.
Oh, well,
Yeah.
yeah.
Correct.
I can hook you up.
That's right. Melanotan is good. So then I love BPC. BPC is, so BPC 157 is body protective compound, and it's made from gastric juices. It's got 15 amino acids in it. It's a repair peptide. And so again, for me, it's just optimizing your body to, you're working out, you're recovering quicker, you're always prepped in your body's an optimal, shape for prevention of injury, because we can use it for injury as well. So if somebody has an acute injury, we can use BPC. It helps to repair the injury. We can use it before, during, or around, perioperatively, or post, to help people get through surgery quicker. Because it allows inflammation, but what impairs healing is that you have too much inflammation and then you can't heal. So this allows you to get inflammation, but not too much of it. So it actually improves orthopedic surgeries with a lot of swelling knees and shoulders. You'll get repair and quicker recovery times. It's helpful for gastric issues, stomach issues, all of that. It does come in a capsule form. I still prefer injectable. I feel like you're going to get more of a benefit, and maybe GI would be okay from a
that was a huge benefit for me.
I feel like that's the one time where you might want to do a capsule or try a capsule, but again, it does help. And if you want to tell about the GI issues, it just helps repair your whole GI tract and stomach. It makes you feel like you're 20 again, where you don't have those stomach issues.
Oh gosh, probably, I don't know, probably 10 years ago, just traditional medicine diagnosis of, GERDs, acid reflux, and ulcers, just various medication. I had some back issues when I was younger, bad. And so having to take pain medication and various medications just to try to get through therapy for my my discs. And that has compromised my stomach. And so after all that and, NSAIDs and all those things, BPC repaired my stomach lining. So now no GERDs, no acid reflux, nothing like that. Even eating certain foods does not bother me at all. And I'm just shocked, that it really did. I mean, I can definitely tell a difference in all of those things,
Yeah. And you can get most people off their acid reducing medicines.
Tell me about it.
With that.
It's life-changing. Yeah, it's life-changing.
Getting you off of medicines that traditional medicine will put you on. And again, in traditional medicine, we are trained to put somebody on medications but never take them off. Like there's no game plan for taking anyone off,
There's
right?
no insight.
Yeah.
No
It is.
insight.
Keep putting pharmaceuticals on people.
Yeah. It's an acid reducing medicine, which we have acid in our body for a reason, right? So if we don't want to reduce that to nothing. You don't digest as well. You don't protect, your lining. You just got to make it healthy. And so you want that acid production. And again, so we put people on acid medicines, high blood pressure medicines, cholesterol medicines with no conversation about when we're coming off. What's the end game plan? You're going to be on it for life. And so when people ask me if they're going to be on hormones for life, I mean, I think optimizing what's missing in our body for life is a lot better than taking an artificial medicine that's
Right.
synthetic.
It's like you're
that's gonna
naturally
have,
repairing that.
for life.
Absolutely.
You know?
Absolutely.
And I was on not only those medications, but like antacids too, all the time, because you know that's what they tell you to do. And so that's what I did. And then finally, I just said, I'm not doing this anymore. I don't like taking all these medications. So I kind of stopped, and then just kind of dealt with it. And then, you know, you got me into peptide therapy, and the BPC 157. It was just amazing to me. I don't, you know, I threw everything out.
Yeah.
You know, I don't even keep them in the house just in case. I don't need them.
BPC is awesome. Yeah. It is another, so those are my three favorites actually: CJC, 1295, Ipamorelin, and BPC, which is a second injection, and then Melanotan. And again, Melanotan's dose till you get a tan, then you can cut it back. So I'm not taking that on a daily basis now. I just take it, and it actually provides immune support too. All of them do. And so CJC and the growth hormone peptide will provide immune support, but so does Melanotan. So again, during all of COVID, what we didn't talk enough about was immune support of, you know, your own body and taking control of your own body. Instead, we're talking about vaccines and medications and censoring and you know,
who's wearing a mask and who's not.
and who's wearing masks and who's social distancing, with zero science behind a lot of that. And yet we could take that and whatever people choose, however people choose to protect themselves, and instead allow them to do those, but also provide them immune support behind the scenes, like vitamin C, vitamin D, and, you know, again, these peptides that could be immune supportive. So instead, you know, we talked a lot about things that
don't make a huge difference
and cost a lot of money. And so meaning that, so somebody's there profiting, and that's the only reason why we're talking a lot about them and not about things that we can do to empower ourselves to be immune supported during COVID. So, and so those are my three favorites. Anybody else have a favorite that we didn't mention?
It's not necessarily my favorite because I haven't taken this one, but could you go over Tessamorelin?
Yeah, absolutely. So Tessamorelin. So when we talk about growth hormone peptides, like I kind of summarize it in a growth hormone peptide to simplify it. And when we're looking at those, usually it's a combination product. So there's one that has a growth hormone releasing hormone. And of those, there's generations. So a first generation would be Tessamorelin. You know, has some side effects, affects some hormones the wrong way. And so we have fine-tuned it to have a better option now, which is CJC 1295. That's another growth hormone releasing hormone, second generation. Third generation is Tessamorelin.
Okay.
So Tessamorelin has a more sustained release or increase in IGF-1, which has the final effects. Some people will definitely only be on it a month or two and cycle off of it. Some providers are using it for longer. We're still a month or two cycling them off onto CJC. So definitely a 6-month program of growth hormone, because, you know, growth hormone peptides, you need at least 3 to 6 months. And usually I say 6 months to get body composition changes. You will see body composition changes, but you won't even start to see it till 3 months. And between 3 and 6 is amazing. And so again, getting a baseline weight, getting some pictures, getting a body composition, you know, test so that you have more objective numbers, because the scale doesn't always tell it all, right? You may build a lot more muscle, lose some subcutaneous fat, lean muscles more, weighs more, and so you may not see it on the number, but you're going to see it on pictures and body composition. So that's why we'll repeat that, you know, at the beginning, middle, and end. But basically, Tessamorelin, I definitely think some people love it, some people don't, you know, because you're injecting more fluid with it. It is definitely more costly than CJC. You're injecting more fluid. Sometimes people will get local reactions to the increased volume that you're injecting. And so some people don't love it. Some people love the effects. And I feel, again, if anybody has more of like what I term a metabolic syndrome, where, you know, bigger waist, high blood pressure, now their lipid panels are abnormal, and we have a little more ways to go versus, you know, just some extra poundage that we want to change from fat to muscle, but we have like a central obesity. That's really what we consider if we look at somebody and say metabolic syndrome. Tessamorelin's a good product to add into the growth hormone peptide. So
And with that also you have Aod, which is the anti-obesity peptide. And you can add that in as well to help with that central obesity for the weight loss. But that is not, a one type fits all. So some people react very well, some don't. It depends on if you have that receptor for it to attach to or not. But there are other medications like the IFG-1 that also go with it that help build lean muscle and help with weight loss. So when we're talking about that patient with metabolic syndrome, Tessamorelin is a better option maybe than CJC and Ipamorelin, but also there are other peptides that can pair nicely with that as well, like Aod to help with weight loss and help get rid of that central weight.
And then we're talking about, she's exactly right. Like, so there's so many different options. It also depends on how much somebody would want to inject. So if they have to inject a second product, maybe we do Tessamorelin instead. So Tessamorelin is always paired with Ipamorelin or Ipamorelin, depending on whose. So it is paired with that. So if we're talking about growth hormone releasing hormone, we're talking about 3 generations, Tessamorelin, CJC 1295, and Tessamorelin. And then there's growth hormone releasing peptide, which again works a different way in the brain to increase growth hormone. And so that is like a GHP 2 and 6. We're like first generations, again, side effects, some hunger issues, and again, affects some hormones the wrong way. So we have fine-tuned it and now have second generation Ipamorelin, which does not have the effects on cortisol and prolactin that the others do, don't cause that increased hunger. And so, but their Tessamorelin is paired with Ipamorelin, just like CJC and 1295 and Ipamorelin. The one thing is, and again, that's why you need to find a provider and an office that work for you, that are going to fit for you. Do not order them online. You will get the wrong dosing. You don't know about the purity. You're injecting things into your body. I mean, there's lots of patients that we have switched from, a online ordering, I won't even say which one, that's not even suited for animals on the website. And I get, that's a legality for them, but do you really want to inject something into your body that isn't even suited for animals when they're selling it to you, and then you don't know the purity?
You don't know where it's coming from.
Don't know where it's coming from.
You don't even know what you're injecting, honestly.
And they're not going to give you any guarantees. And honestly, we have had multiple patients switch over with great effects on, prescribed from a reputable pharmacy versus that online purchasing of laboratory.
I'm just shocked people do that.
Yeah.
People do all kinds of crazy things, Lori.
That is scary.
And they're 100% TCA on Amazon. 100%. So
Yeah.
No, thank you.
Yeah.
And so those are all iffy. So I wouldn't recommend that you do that because, again, DAC is something you can attach to CJC 1295 and its drug affinity complex. It makes it a longer acting. And so the dosing would therefore be different. You don't know what you're thinking about as far as dosing. If regular CJC is lasting 30 minutes and then drug affinity complex is 7 days, you're going to clearly dose those differently. And so again, you got to know what product you're getting and purity. And we don't use something with DAC attached to it because it's just too long a half-life, and the half-life naturally for growth hormone releasing hormones 30 minutes in the body, so you don't want it any longer than that. So just finding a provider, it's well worth the money to know that you're not injecting toxins into your body, and that you're dosing everything the right way. So
and there's so many peptides, and making sure that you're getting the right peptide for you.
Yes,
that is huge. We've talked about so many today that we love, but there are more out there that might be better for you. They might not be one of our top 3 favorites. They might be something we haven't discussed today, but that really meets your needs and what you're looking for. So finding a provider that's knowledgeable on the different type of peptides and can really take that full comprehensive evaluation and find what's best for you is so important.
Well, that's what I love about the office, because, it's to each person, it's to each patient that you put those programs together, and that's
it's all
the goal.
Individualized because everyone's so different in what they need, and
extremely
again
important.
you can stack, and it depends on what the patient's willing to inject. There's so many different benefits, and again, Faraday talked about Aod and Igf Lr3, and again, those are next on. I actually tried them kind of didn't really even intend to at first because I love CJC, but then I tried the AOD and IGF. I think we had somebody that didn't pick it up, so I ended up having the peptide, and I thought, well, I'm going to try. AOD is a specific segment of growth hormone that metabolizes fat, and Faraday's right. It doesn't work in everyone. When it works great. We pair it with IGF Lr3 because that, again, is more of the liver effects of growth hormones, so muscle building, decrease fat. So it does work even if the AOD doesn't. So they pair well together. And I think for that leaning out, gaining muscle, just more ripped, muscles, abs, legs, and especially as we start to get perimenopausal and menopausal for women, but for men as well. Stacking those are good. TB4 is something that we'll use for inflammation, so it can be used again with BPC if somebody has an acute injury, and it's TB4, or we can use it for hair growth and inject into the scalp.
Absolutely.
And we'll inject it into the scalp. We even have a laser treatment. That's a fractional non-ablative laser that we can put some peptides topically on, and TB4 happens to be one of the peptides in that product as well. And so that works very well and then TA1 is an autoimmune. So if somebody has autoimmune, condition, we can help with that. And there's neurologic ones. There's all kinds of different peptides you can use for different, NPT141, again, a sexual.
The libido booster. Right?
The libido booster, orgasmic strength. That one's a huge one. Most people are going to love that. It just depends on when. When are they going to love it? Because they may get nauseated with it. So definitely not something recommended for like a big event or trip because it can have some nausea. Usually, it depends on the first dose and how high it is, and they do acclimate to it. But sometimes people get nauseated, and then when is it going to take effect? Is it going to kick in 30 minutes or 5 hours? And so it increases orgasmic strength, and it also can increase...
That, right?
Who doesn't want that? Yeah. It's definitely worth trying. And they, again, now have a manufactured version, but I think you get like 4 doses. And again, it takes you 4 doses just to figure out your timing and your nausea. And so, you want a month's supply of that. And again, even if men are having any kind of functional changes as we're going through our sexual wellness treatments, they can actually do PT141, and it increases their orgasmic strength, ability to get erections another way, not just a blood flow way. And so they'll get spontaneous erections sometimes with that, gives them that confidence back that they're going to get erections, which is part of what happens when they start to notice functional changes, is that they don't have the confidence they're going to keep it every time, and us building that confidence is part of the treatment. So can you think of any other ones that...
So we did talk about BPC, and we kind of really focused on the gut a little bit.
Right. Mm-hmm.
But BPC is also great for acute injuries and chronic injuries. So we had a patient recently that had a shoulder injury, and within 2 weeks he was noticing a huge improvement and decreased pain, working out again, able to start working out with more weight without any issues, and then also with chronic pain. So my husband is taking BPC, and he has chronic back pain, lots of inflammation, degenerative disc, and he says all the time with a low level, of pain all the time. And since taking BPC, he said that has decreased significantly and is feeling much better just day to day. He is out doing activities, he is out, all of the different things that he used to love to do, but that next day, has that pain that he knows is coming. And with BPC, that pain isn't there anymore. He's lifting heavy and not having pain the next day. He's getting out on the boat and doing some of these water sports he used to do, but then knew the next day he's going to have pain, and that pain's not there anymore. So I wanted to make sure we kind of brought that back as well, because that is one of our favorite peptides for more than just GI, also for the benefits that it helps with the inflammation in the body and helping with pain as well.
I'm glad you brought that up, because I kind of wanted to come back to that as well, because that was kind of like the second thing for me. I'm a Pilates instructor, and just from previous injuries before finding Pilates, I have a hip tear, a terrible hip labrum tear. fell on my coccyx, various things that, just over the years, you do things and things happen, right?
Yeah.
And
we're hard on our bodies.
We're hard on our bodies.
Backflips.
And then,
during wedding receptions don't help either, right?
No experience whatsoever.
I'm not sure that's podcast
That might be a different conversation.
That's not a good conversation to have. But things happen in life, right? Either way, that was one of the benefits. Exactly what you just said. Like, just decrease pain over time. You find that it just slowly repairing. I had a shoulder injury, again, years ago, bad golfing, without instruction, you just do something. And all these little things have added up. And then I started taking BPC. And that's the reason why I started taking it, because my shoulder was just extremely painful. And then, I jump on my machines, and then sometimes that aggravates things too. Oh, yeah. You already have this previous, injury. And then now that I've been on it for a longer time, I don't really have that chronic fatigue, or the little pulling, or, those kinds of things. So, huge benefit, when it comes to inflammation in the body and everything, brain fog even. But I'd have to completely concur with him, because it is incredible that way.
And it does tend to happen where we'll put somebody on it for acute injury, acute elbow. At least one of our patients had acute elbow injury, was already doing hormones and CJC. So we'll have those conversations. And again, for our patients, just to know we have other options that we can help with. And having those conversations. So if they're in and we're talking about hormones, and then all of a sudden they bring up their injury, we have a laser that pairs well with, PRP injections to an injury if we want to, or we add BPC to the laser treatment that hits a little bit deeper. So there's all kinds of other options besides pain medicine, anti-inflammatory, steroids, and surgery, and PT. Again, getting that range of motion back with BPC while you're repairing, and maybe bring some stem cells with the laser help. And a lot of patients will have that. Like, he had an improvement of his acute elbow injury after we actually had the discussion, started him on BPC, but had chronic back pain that improved as well. And so he's not coming off of it anytime soon.
You don't really get any, there's relief in medication, but it's constant. You can't get out of that cycle. You take the medication, and then you're, then it works a little bit, and then you're in pain. And then it's just this constant battle of painkillers, and it's not healthy. I mean, because you're destroying other parts of your body. Mine was my stomach, which is what happens. And so these actually get you somewhere. They repair. I don't even take NSAIDs anymore. I mean, I have to have a really bad headache to even take a Tylenol, because I just don't want to, I just want to take a medication. But yet now it's actually fixing something, and it works.
Yeah.
Right. We're not just slapping a Band-Aid on it.
Correct.
And adding to the problem.
Right. I mean, it's a solution, a real solution. A life solution.
Yep.
Peptides are amazing. It's a life changer. Yeah. All of these are life changers.
On the peptides, I slept better. I will sleep better, and I will wake up earlier.
That's one of the first effects of CJC is sleep. So body composition changes,
mental
sleep, those are some of the big things. Repair. So for those that are very athletic, and again, we have a lot of athletic patients that, have slower recovery times as we age. Growth hormone helps with recovery and quicker recovery after workouts and hard workouts. And it's not that they're injuring themselves. It's just it takes us longer to repair and recover after a hard workout. And so peptides help us do that faster, even CJC and growth hormone. Yeah. And then I think one other one, and again, we'll let you guys comment in the section. Let us know if you have any experiences with peptides that you want to share. Or any questions that we can answer. We can go into other ones. I just wanted to touch real quickly on GHK-Cu, which is a topical. There is other ways to give it, but that works really well for skincare products and for hair growth as well. So you can use it topically on the scalp, and we have products for that. But because it causes increase, proliferation and healthy function of the hair follicle, but that's only if there's hair follicles that are heavy in that area, like eyebrows or scalp. But otherwise, it's cellular repair, DNA repair, helps with fine lines and wrinkles, improves your blood flow to the area, again, protects from UV damage. And, so again, you're getting repair of everything, better texture, fine lines and wrinkles, better pigment, better blood flow, all of that. And so that's another good one that I like.
Is it the RMD cream?
Yeah, so it's in the RMD cream
That's amazing.
as well.
Yes.
Yeah.
Good stuff.
Yeah.
Yes.
And so that was with a couple other different products. It has 4 in it together, but GHKCU is an awesome one for skincare. So
Then adding collagen to it.
yes, and adding collagen, the building blocks for everything that we're doing to stimulate collagen, elastin in the skin. So if you guys have any questions that you want to share, please do. Please comment. You can also email us at connect at RevitalyzeMD with a YZE at the end.com. You can call the office, make an appointment, and we could set you up with an appointment with one of the providers so that we can let you know if some of these peptide treatments are for you, or if you have experiences you want to share, please do that in the comment section. And again, I want to thank everyone for coming today. Marissa, thank you. Faraday, Lori.
Thank you for having me.
Thank you for having me.
And if you guys have questions, let us know. Share, subscribe, like, do all of the above. And then again, we are willing to deep dive into anything aesthetics or wellness. And we're here to revitalize your look, your health, and your sex life. Thank you.